Hello, welcome to Raaonline. I am Dr. Vijay Raghavan. Let's talk about umbilical hernia. Actually speaking, umbilical hernia is a wrong term to use in clinical practice. Exact term umbilical herniation happens in the fetal development. Any defect causing the hernia around the umbilical should be called paraumbilical hernia. Now coming to the etiology, neonatal umbilical hernias are due to prematurity, and spontaneous closure is a definite. Spontaneous closure is going to happen during the maturation and development of the child. Failure to close the primary facial defect created by the fetal extra-abdominal rotation is the cause for neonatal umbilical hernia. Acquired is nearly 90% of the paraumbilical hernias. It is predominantly seen in female, the ratio of 3:1. Any cause for chronic increased intra-abdominal pressure like pregnancy, ascites, chronic peritoneal diastasis, COPD, persistent bowel distension or obstruction can lead to paraumbilical hernia. Obesity is another major factor. Stretching of the anterior abdominal muscle with the presence of fat which separates the muscle bundles and layers and weakens aponeurosis can be the cause for paraumbilical hernia occurrence. Coming to pathophysiology, the herniation is through weakness at the exit site of involuted umbilical vein or through weakened umbilical fascia. So when you do the hernia, the layers of the hernia are the skin, subcutaneous tissue, superficial fascia, umbilical fascia, peritoneum, all fused together as single one layer. Cirrhosis liver is often associated with paraumbilical hernia due to high intra-abdominal pressure due to ascitic fluid. Dilatation of the umbilical vein can be the cause for weakening of the umbilical site. Poor nutrition leading to weakness of the muscle and connective tissue can predispose to paraumbilical hernia.